This is known as the window period because the physical changes that come up with aging do not show till a decade after menopause, by which it is really late. So this is the time to do your strengthening and to continue with a very active lifestyle more than what you were in your 30s.
Hi, everyone, and welcome to a brand new episode of Say Again with me, Amrita Tripathi. I'm delighted to be in conversation today with Dr. Ruma Satwik, Senior Consultant, the Center for IVF and Human Reproduction at the Department of Obstetrics and Gynaecology at Sir Ganga Ram Hospital in New Delhi. Dr. Ruma, thank you so much for joining us.
Thank you, Amrita.
So there's a lot of questions that I want to ask you, and this is the best opportunity I found is to host you on a podcast and just hand the mic over. But let's start with some of the most common myths and misconceptions when it comes to your area of expertise. I'm seeing a lot, especially as I grow older. I'm realizing that a lot of the information we get is either secondhand or nowadays on social media, and there tends to be a lot of misinfo sort of smuggled in there along with some nuggets of actual gold. Can you tell me maybe one pressing issue you'd like to highlight, or maybe one myth or misconception when it comes to, let's say, fertility and women?
Yeah. So often I get women in their early 40s or late 30s who have just decided to, start their journey into parenthood. And they've come to basically get an assessment of whether things are fine or whatnot, but also that they would have consulted somewhere outside. They would have had certain tests done, especially a fertility hormone called AMH. And, invariably, one would know that fertility declines with age. So it's somewhere this fertility hormone called AMH has been tested and it comes out to be low, let's say something like zero point 0.8. And they come to me in a state of panic that I have just been told that I cannot conceive. So that is one myth I'd like to clear, that it's all right. I know, I mean, one does know that fertility declines with age marginally. Uh, it declines rapidly after 40, but there is still, there's something known as fecundability, which is a woman's ability to, let's say, conceive per menstrual cycle. And if that is at 30 to 40% for a younger woman, for a woman who's at 40, it is not zero, it still is at 10%, which means that per menstrual cycle, if 100 women were trying to conceive, 100 women aged 40 were trying to conceive, 10 would be able to conceive per menstrual cycle, and that is something that you need to know. So it's not as compared to a 25-year-old, of course, it is down from 30, but it is definitely non-zero. So if there has been no period of trying at all, I would say just look at their histories, nothing found there, maybe assess the partner, nothing found there. I would just reassure her, send her back home, say try for 6 months. If you're unable to, which 40 out of maybe 100 women should be able to in the next, irrespective of their fertility hormone status, in the next 6 months. It's all good. Otherwise, come to me, I'll institute and start treating you then.
So when we talk about this, and I also want to acknowledge, of course, that there is so much um, I don't want to say emotional baggage, but there's so much pressure. There are so many factors at play when you look at something like fertility. When you look at women who are coming in, I'm sure you're also looking at that full. You see a much more holistic picture than we might imagine. Can you take us back to and this is, I'll say this as someone who's a former journalist, and I was writing about the biological clock ticking when I was 25 and freaking out, and then just wondering what I would be doing in my life and legacy and so on. But can you talk us through the actual science of this, like what's happening when you see most women, like we were just chatting about, coming in a city like Delhi? What's going on, and what would your advice be then if people want to actually take family planning seriously as well?
Yeah. So, female fertility is bound by age, and this is not true for men as much. Men can have children if they wish to, well into their 60s. For women, that average age at which they will be able to have a child is 40. And there will be some women on both sides of the divide, but if we were to look at what is the upper limit for age at which women would have their children, it may not cross 45. For all claims above like 46-year-olds conceiving or 50-year-olds conceiving, I mean, that needs to be scrutinized, that needs to be looked into. There are some ethnicities, perhaps in Western Asia and along with Kyrgyzstan and that line, that belt, where perhaps because of their later menopauses, on an average, they also have their fertilities going on longer. So perhaps in that area, up to 48 years is what women will have their natural fertilities up to. But let's talk about the averages. And while you will see that how the industrial revolution and the post-war world, how better education systems and all that has changed so much about how we live, how we decide how much we want to continue with our persist with our professions, at what point we want to marry, who we want to marry, who we want to love, whether or not we wish to have children, at what age, and all that. So all those choices we as women have today, more than perhaps maybe not as much as we would like, but certainly more than what a generation ago, what our mothers did. uh, and based on that, what has happened is that the average age at which, let's say in a city like Delhi and in most metropolis, that women would decide to have their first child would be after 30 years of age. And which is all fine, which is great. Most women should be able to till about age 35. But what happens after 35 is that your ovaries, which are a storehouse of all the eggs that you will ever produce, and the ovaries can't make any new eggs, they are steadily losing those from the point a girl is born. By the age of 35, this loss rate is accelerated, so that what you are left with is a lesser number, and the ones that are left behind would also be lesser in quality. So, if you ask me what is the best age to have your first child, I would still make it at 35 or at less than 35. For those who are above 35 and making that call, I would say it's all right. Just get an assessment done by a fertility doctor. Let her decide or him decide, or check you for other risk factors. If you have none, it is still all right to try out for a certain period naturally, and most will find that they are able to get there. But for those who can't, of course, the availability of other services, fertility services, is good in a city like Delhi, in metropolis, and in most cities now.
Yeah. Yeah, I do want to come back to we're talking to you for the medical expertise, we're talking to you for the actual facts and the evidence-based science, but it is such a fraught topic, right? Because I feel like, from the sort of the child-free cat ladies we're hearing about the US, I mean, coming into the political discourse, to the pressure on women, on so many levels today. Of course, there's pressure on men as well, but when it comes to childbearing, family planning, and like as you're saying, as we're all taking control of our careers or trying to, be independent, there's a lot of mixed messaging. Do you find that, alongside this, and I do want to ask you your thoughts on how open people are nowadays on average when it comes to conversations, let's say about IVF, ART, fertility, but even taking a step back and talking about, say, menstrual health, period health, things that might be going wrong. Because I think for a subsection of us, and again, the way social media works is if you're interested in certain topics, you'll get tons of content on those topics. But I'd be curious to know, I mean, do people come into you with, on average, a fairly, good understanding of these topics, or do you find that there's a lot more awareness building that needs to be done?
Yeah, I think you'd find that younger women will. approach more easily if there is a problem with their menstrual issues, and what is it really that's bothering them. It could be premenstrual syndrome, it could be, and that is something which is a common issue with a problem that girls confront face very commonly. uh, the older women will not come, even though they have a menstrual issue, thinking that this is age associated, age linked, which of course it could be, which and that is how your periods wane off as you age. The irregularity sets in. But what is missing, I mean, what needs to be told is if it is heavy, if it is prolonged, if it is happening in the middle, let's say you start bleeding in the middle, those are the points when you need to approach a doctor, get yourself assessed. Where an assessment is not extensive, it is an examination, maybe an ultrasound at the most, and that it can be sorted on most occasions. Everything does not need, and that is something I feel very passionate about. Everything does not need a hysterectomy. Uh, in fact, most issues of menstrual abnormalities in older women can be settled with reassurance, sometimes with medicines. And of course, a check is, however, needed to rule out some of the other things.
Okay, that's interesting. That's me. That's older women. I'm going to be talking to you after this as well, because also because my hypocrisy meter is very high, and I know that I have loved ones listening to this will be like, "We've been lecturing you to go and see a gynae for ages." But I do want to ask, you've been practicing now, Dr. Ruma, for how many years? On
uh, Steen in the field of infertility, and
16 years.
it's been 22 in the field of gynecology. I
Wow.
finished this graduation in 2002. Yeah.
That's incredible. Wow. Well, pat on the back to you. That is awesome. Have you seen any changes broadly? I mean, it's a big question to ask about trends, but sitting in Delhi, and you of course get patients from across the country at Ganga Ram, I'm sure. You also have like a very wide network yourself. Have you seen any sort of broader trends that you'd like to share with us in this field?
Yeah. So, as a postgraduate student in Sholapur, Maharashtra, this years 2000, 2001, and 2002, uh, there was absolutely no stress on infertility. And infertility was perhaps put in the somewhere in the corner, in the back. What we would mostly deal with are issues of uterine prolapse, women needing hysterectomies. That was the norm for most problems that they would come up to us with. And maybe the pregnancies, cancers, stuff like so what would be called as issues which are organic and would need mechanical or treat other treatments. Infertility may not have also been such a huge problem then, largely because women would decide to conceive early on. As age advances, the incidence of infertility increases. But also the way we would, I think, generally look at, oh, ये infertility का केस है तो मतलब ठीक है, ये दवाई दे देते हैं, ऐसे करके आप 1 महीना 6 महीने और ट्राई करो और फिर आ जाओ, हम देख लेते हैं आगे क्या करना है, without going into the details of what those problems might be. For instance, it could be simply an erectile dysfunction. It could have been simply an inability to actually have sexual contact, and those are real issues, which we are now able to talk about, and which women will come up with a lot more openly than they could then. And of course, it took a lot of every anything that women presented with then would start with pota dukte. That means it's hurting in my stomach. And so you look at who has she come with. If this is with her mother-in-law and she's looking at her feet, it's quite possible that she's pregnant, and that she's not able to still tell us that this is what is happening. So you will find that less often. You'll find women talking about it more directly. You'll find women approaching us directly. And the other thing that has also surfaced and increased now are women who have endometriosis or period associated pain, and that has gone up significantly. I wouldn't see it as much in my postgraduate days. And one reason for this is, again, I mean, it might sound politically incorrect, but the more we delay childbearing, so it is linked to a little bit of genetics. It is linked to the number of pregnancies that the woman has had, and it is linked to the first pregnancy that she may have had. So some of it is associated with that also, and so women in their 30s and 40s with you'd see a lot more of endometriosis and an associated condition called adenomyosis today.
Yikes. Again, I mean, I don't think any of the men listening know how much easier they have it on so many fronts. Do
They
you
have
find that, so go on?
I mean, men have it easy in every aspect. I mean, we haven't even begun to talk about the social aspect of
Yeah.
menopause and aging, and how there are these double standards with respect to aging when it comes to women. And no, I mean, I've been trying to write about this, and I came across this excellent essay by Susan Sontag. I'm sure you would have read it. It actually is called The Double Standards of Aging. Uh, she wrote it way back in 1972. And she uses this line that how society has a double standards for treating uh, how men and women age. So, aging men versus aging women, and that's perhaps because the assets we value in a male, you know or how conventionally it has become, his social status, his earning ability, very little to have to do with looks and appearance, but yes, those things tend to go up as the man ages, and so his value in society actually improves, as opposed to what is valued in a woman socially, her physical appearance, frailty, this thing about being helpless, and all that, and how that declines with age, and how it's quickly taken away from an aging woman, and how she's quickly devalued. Of course, she argues about on how you don't have to give in to that. You have to continue being where you are, but I have to say, there is a bit of a role that hormones also play here. And there is a difference in biology that there is this gendered the difference that exists. I mean, this could be a whole chat on why the gender difference exists, the biological difference, but because this reproductive potential is lost in women, what we were talking about just a short while back, it's lost quickly. It is also that her hormones are likely to go away very soon with the reproductive potential. That's when menopause happens. And when these hormones, that reproductive hormones like estrogens and progesterones, also disappear from the body, what that does is these hormones were plumping up the cells of the skin, of the joints, of the muscles, of the cartilages, of the brain. And I'm not saying that these are the only things which are responsible for their health, but they were significantly there. They were significantly responsible in maintaining the health of these structures. And you find that there's a sudden, sharp, steep decline in the visible effects of this loss. So, skin, for instance, hair, it could be your ability to move, run, your there will be a brief period where women will have brain fog. So, distribution of fat around the midriffs and all that. So a lot changes suddenly, and it comes through so well in sort of everyday encounters, and especially during the pandemic, when you did not meet couples for several years, maybe for 2 years, and suddenly things opened up, and we of course became less cautious than we were, and you see couples, and you see the difference after 2 years. Of course, everyone has been through so much, but you see that this effect of age creeping into women was just higher than in men. So I mean, eventually men get there, but it's a steady decline, slow decline.
Yeah.
Women have a reverse S-shaped curve in terms of showing
And
their.
so, there are obviously great things that happen as you age as well. Like, I think women get more confident, all of those things. But let me ask you a little bit about what you said brain fog, and that's really, I'm fascinated by this whole thing because all of a sudden I'm seeing all of these Insta videos on perimenopause. So you can imagine what I'm looking up. But because I spent more than 30 seconds on one, I have a ton of these. So can you take us through? So what, earlier we used to hear about, I think, pregnant women getting brain fog, or you had mommy brain. Now you have brain fog, hormone related when you're a certain age. Can you take us through, this, and then I'm going to ask you a little bit more about aging and your attitude towards aging yourself. What's the deal with brain fog?
So there are these areas in the brain, the frontal and hippocampal, which are responsible for thought, intellectual thinking, and I mean, this neurocognitive research in women is still very new, maybe not more than 10 years old. And what one has found are estrogen receptors in these areas. And what is happening with the loss of estrogens is that its stimulus of these areas, the areas that are being otherwise pushed by estrogens as well, are that is gone, and which is what leads to this loss of clarity in thinking, loss of clarity in expression. And however, things get better because there are other neurotransmitters that kick in, which are able to take over that function soon. So while one is adjusting to this loss of hormones, and one of the things is those hot flashes, the other is brain fog. This adjustment period, this transition, which lasts about 2 years to 7 years, is when one will experience this. Uh, Again,
Two
these
to
are not
7 years? Oh, God. Fine. Thanks. Thanks.
these are not constants. For instance, when you talk about hot flushes, which is one of the commonest symptoms,
Hmm.
you find there's again a cultural divide here, and you don't see this as much here. Uh, in countries like UK and maybe the US, even Australia, and now even Japan, the rates of not every woman will have this. For most women, half the women it would be a breeze, as in not. So one doesn't know who is going to have it, who's not going to have it. One still needs to determine the risk factors for who will have these symptoms or not. But uh, it's still at 40%, 40 to
Hmm.
45% women will report these symptoms. The others will not. And then there is a
Hmm.
symptom complex, different kinds. One related to the brain, one related to maybe this what is known as autonomic nervous system, hot flashes, palpitations, maybe weak bones. Related to the heart, related to the weakness, and general aches and pains. So all of that needn't be there in every woman. Some women may have some, the others may have a few, and many will not have any symptom at all. So
So
it's
if somebody has, because I feel like there's also so much psychosomatic stuff that happens, right? Because I'm like, we do also read into, we are Googling, we're thinking this is like one thing has happened. So maybe I have this terrible symptom or disease, which is obviously the challenge with too much information and not enough expertise. If anyone listening to this, for example, has some of these symptoms you mentioned, like when do you think we should go into like check with an expert like yourself?
if it's bothering your sleep, your general functioning, come. That is
Okay.
when we like to investigate and treat. If it
Okay.
is not having a good night's rest, you're able to get through, without feeling, get by the day without feeling, too worked up, too fatigued. It's all right. So, but if any of this is happening, midday fatigue, you're not able to do your usual tasks, sleeping, not being able to sleep well, that's when you visit.
Okay, got it. Making a note again. I think there'll be a lot of notes after this chat. So let me ask you a little bit about your own journey, and when you look at aging, and of course you have the medical science part of it, and you see what um, you take that into, I think, consideration. I'm sure in your day to day life also, but your personal aspect to aging. I'm curious to know what's changed. How are you looking at aging yourself? Are there things that you do or don't do that may have changed?
Yeah. So I think the general acceptance that sort of you're a goner after age 45 or whatever, that has changed. Things, for instance, when I look at my mother's photographs at age 48, that I am, and I don't think I have any of my grandmother's photographs at that age. I only remember them as women with gray hair and older. But I mean, things have changed because we have had opportunities to, be born to women who had better nutrition in the wombs. Which is why we had better nutrition. They were educated in the sense that most women, as would be, they could seek medical help as and when they needed. As children, we were given our vaccines. There were fewer infections that we had as opposed to our mothers. We had better nutrition, access to more, sort of richer foods, no matter what sort of some of our, some people would want us to believe. Women wouldn't survive into their old age on an average. Most women would die either sort of very young, which because infant mortality was very high, it were the communicable diseases that would kill them, or they would die in childbirth. And so, for women to survive that and to live into the age of, let's say, 60 and beyond, you'd probably see, so our grandmother's age, maybe one out of four such women would survive into that age. So, most people would have either died in their early childhood, or if they had survived that, some of them would have had maternal, so mortalities during childbirth. And so, as in, because of those fewer stresses, I feel that, I mean, overall, in terms of how we appear, how we function, our strength, and all, is on an average a decade sort of over and above where our previous generations was.
Hmm.
I mean, it's something that we are confronted with every day. However, that
Yeah.
you're aging and you're getting there, you'll soon be over it and above it. I There's some amount of wisdom that also one accrues and gains. And you mentioned confidence, and that is something that I think has improved us, especially this ability to self-judge less. You can say it's all right
Yeah.
to have flaws. It's okay.
Yeah.
Yeah.
That's beautiful. And I, oh my gosh, yeah, this idea earlier that you have to be perfect or present a perfect persona. I think that does tend to change. Can I ask you a little bit about when we talk about, let's say, 40s to 50s? Again, I'm going to blame my social media feed, but I'm getting a lot of this. This is probably positive and good, and you can tell me when they say women need to be doing more like strength conditioning. Like at this age, you need to be looking at, and this is what's going to take you forward over the next few decades. Can you give us some wisdom on that?
So, like I said, bone and muscle health are driven by, amongst many things, also by reproductive hormones. And, you start facing that decline or an erratic hormone pattern in your perimenopause, so which is, let's say, your early 40s to mid 40s, is when you start facing the erratic hormone secretion pattern. estrogens and progesterone, the estrogens especially, promote bone health. So basically, they are depositing more of the good cells which promote bone formation, and they are reducing the activity of the cells that would lead to its absorption. Uh, Along with that, they are also able to change how muscles function. So its ability to contract, relax, repair itself, stem cell regeneration, all of that estrogens promote. Uh, the third thing is that if you estrogens are also promoting fat deposition in the right place, and the right place is your periphery, so limbs, just under the skin, not centrally. So all of this, when you have the lack of estrogens, more and more fat deposits centrally. If it can't find a place there, it will start depositing in your muscles. If you don't give the muscles the this you don't stress your muscles enough, fat deposition in the muscles is a bad thing. It reduces its ability to function. It reduces its ability to repair. So when you strengthen your muscles, you're also creating a demand for absorption of excess energy so that it doesn't deposit as fat. When you exercise, you are also ensuring that the weakness that will set in with lack of estrogens is pushed, by maybe a decade or 2 decades. And so this is known as the window period, because the physical changes that come up with aging do not show till a decade after menopause, by which it is really late. So this is the time to do your strengthening and to continue with a very active lifestyle, more than what you were in your 30s, and to avoid anything that would lead to insulin resistance, which is fat deposition around your midriff. So that would mean altering your diet as well, more of protein and fiber, less of, so you don't, it's a common thing. You don't drink your calories, you consume your calories if you have to. So all the fizzy drinks, the sweet drinks, anything that has been artificially sweetened needs to be avoided fully. So all the care that one needs to take is in this window period, and of course a little beyond as well.
Okay, so those of you who are kind of my vintage, it's not too late. We can take some notes from this. I think, Dr. Ruma, as we wind down the chat for now, I think we're going to need to do a follow up with you very soon. Um, do you have a message maybe for your younger self? Is there something you wish you knew when you were starting out your career, for example? It was a very different time, of course. Back then, maybe everything was not at your fingertips, and less exposure, less visibility. Is there something you wish you had known?
I haven't frankly imagined that conversation with my younger self. But I think I was generally very harsh on myself, and I couldn't make a public appearance for sure, which I'm able to now. So, in terms of, but that's a journey I think we all go through. I don't think, at that point in time, things could have been any different from what they are now. So each day is new because of the challenges that I face in my practice, in my work. That's because each patient that I see could be very different from the last. And so, really, I mean, there is not much that I'll be saying to my young. Yeah.
Would you have guessed though that, I mean, obviously takes a lot to stick it out in a field like yours, as a woman doctor in this field. Would you have guessed that there have been as many ups and downs as there must have been?
Yeah, there have been lots. So I think the first thing that postgraduate training is about is just roughening it up for you. I mean, so bad that anything after that seems, oh, okay, I'm entering into a nicer, better world. So, yeah, I mean, and I think that's something I'd like to change though, because the postgraduate training was rough, it was rigorous, it was not only do you those grueling hours and 36 hours, that's just a small part of the story, but I think the other is that generally you have to confront these super nasty seniors who can sometimes be okay, nice to you, but most of them will not, because perhaps it's the nature of the work. It's the nature of the work, and any slightest of things going wrong is pinned on the junior most person and not on, I mean, people don't take responsibility or own up as easily. That's something I'd like to change, and I think I have managed to institute that change where the seniors own up, the take that responsibility and not pin it on the junior most person. But yeah, I mean, the challenges with respect to patient care, I, I think I'm in a fairly good place. It allows me uh, an exposure to the private world, to the public healthcare model of care, and it allows me to never say no to a patient, even though there are no, let's say, funds available of which she can't afford her treatment. So it is possible to do those treatments even if one comes from a very poor background, and that's something about Ganga Ram I really appreciate.
Oh,
It
okay.
allows me that.
That's yeah. I think that is actually a really heartening note, probably to end on. Maybe one final message from you to younger doctors in your field, because things keep changing so often. Is there something you would you tend to tell people you're mentoring, or any message you might have?
Younger doctors, I think, need to get their theory right first, and you learn practice within the first 5 years of your postgraduate training. But unless you have your theory in place, you will not have a sound practice. And it doesn't end there. It's a continual sort of re-educating yourself, and that willingness to change to new knowledge that is coming in. So do not sort of just get fixated on this is what I have done during my postgraduate years, and so this must be the truth. Truth changes, and that's how we evolve. We have to know that and allow ourselves to evolve with it. I think, yeah, that's the message.
I think it applies to even non-medical people in different fields. Thank you so much, Dr. Ruma, for taking the time. Thank you for your wisdom, for your calm, and for maybe adding a little level of stress into this conversation to us to take our health seriously, especially for the women who've not been maybe realizing all the signs and symptoms. Thank you so much.
Okay, thank you, Amrita. Thank you.